All right, guys, going back to sharing our screen so that we can continue working. So I like to remember Elizabeth Blackwell because I call her Dr. Blackwell. So that in my mind, whenever I see Blackwell, I say Dr. Blackwell. So she was the first female doctor in the US. And up until this point, only men were doctors. There still was that men have their role, women have their role, women were nurses, men were doctors. And this started to change during this time. Clara Barton founded the first American Red Cross in 1881. So now, obviously, the American Red Cross is still there. They assist. Obviously, a lot of people know about blood drives and things like that, but they also assist during natural disasters and things like that. And Clara Barton was the one who did that. So I always remember Barton, T, Cross, Clara Barton. Moving forward, we have Paul Ehrlich here. You are not required to know his name, just those individuals who are listed on the assignments that I gave you. The past 2 days are the ones that you need to know. But he discovered the magic bullet, which is basically chemicals that are treating syphilis, which is a sexually transmitted disease that can also show itself many, many years later. It has a long latent period. So that it was a great discovery of that time. We have Louis Pasteur, who you do need to know. This one to me is easy to remember because what he created is called pasteurization. Pasteurization of milk is basically heating the milk up to a point that it kills the microorganisms, diseases, and germs that are there before we heat it up. So we basically heat it to above boiling. So it's really, really, really hot, kills those germs, and then it becomes safe for us to consume. So Louis Pasteur did pasteurization, and he also developed the rabies vaccine. Up until that point, rabid animals were not as fully understood, and anyone who came in contact with a rabid animal and potentially had the disease was pretty much given a death sentence because we couldn't treat it. Moving forward to Joseph Lister. So I like to remember Joseph Lister and Listerine. So Joseph Lister created disinfectants and antiseptics that he created it after he realized that carbonic acid is what was killing the germs. And so now the same antiseptics that we use during surgery to kill germs and make sure that we can keep that environment safe or sterile, if you've ever heard that word, was from Joseph Lister. So Listerine. And that's what you see here in this picture. Robert Koch developed the culture plate. So what you see here is a culture plate. So if we were to take a nasal swab from someone to find out if they had a certain respiratory illness, what we would do is swab the inside of their nose, and then we could swab this thin plate that you see here on your screen, and we would watch it to see if anything would grow from it, because bacteria is living. So it grows, it multiplies, and we would watch it to see if it did. And so because he created the culture plate to identify pathogens, which pathogens are just what makes you sick, he was able to discover the germ that caused tuberculosis. And if you don't know what tuberculosis is, it's still around. It's a respiratory illness that is highly contagious. If one person in a room has it and coughs, then we potentially transmitted it to everyone in the room. And it can, of course, be deadly. So this was a really important discovery of this time. Moving forward to Wilhelm Roentgen, he invented X-rays. So what he did is he was working on how we could view the inside of the body, and he accidentally X-rayed his wife's hand, which is the picture that you see here, and he realized I can perform this procedure or diagnostic to diagnose someone. I can do this, and we can view the internal aspects of the body. Now, you guys know we have MRIs, we have CAT scans, we have all different types of studies now we can use to look at the inside of the body. But up until this point, we did it. So the X-ray was a huge accomplishment for medicine during this time. And we are increasing the lifespan to 40 to 60 years, and that's amazing. We were able to classify the blood groups in the 20th century. So even though we were doing blood transfusions in the 19th century, didn't know much about blood types and how different blood doesn't mix. So if you're A positive, you can't receive blood from someone who's B negative or B positive because it's different blood types, and your body will attack it, and you can get what they call transfusion sickness. So we were able to recognize and identify the different blood types that you see here. We also discovered in the 20th century that white blood cells fight disease. We call those leukocytes. So that's from our first unit, leuko meaning white, cyte meaning cell. So we discovered that white blood cells are the ones that kind of come in and fight the diseases. So that's what you see here. This round disc is a red blood cell, and this white spiky thing that you see here, that's going to be your white blood cells. They recognize and they fight different diseases and illnesses. We began to grow viruses in cultures. Viruses are a little bit different. They're not living, but we were able to kind of watch them replicate in their own process. So we could start treating viruses as well. We formed health insurance in the 20th century. Up until that point, we didn't have anything. People had to pay for medical costs out of pocket. But if we could have health insurance and you pay something per month to kind of keep yourself healthy and have availability to all those medical inventions we were creating, then that was a huge step in the right direction. And later on, you're going to see the point where the federal government comes in and starts providing Medicare, Medicaid. Insulin was discovered to treat diabetes. Diabetes is not something you can prevent through an immunization or a vaccine. So if you get diabetes, we have to treat the diabetes. So we were able to discover and start to use insulin. You do need to know that. Alexander Fleming discovered penicillin, and this is considered the most important discovery of the 20th century because penicillin was the foundation of a lot of those antibiotics we use to this day. Moving forward, antibiotics and sulfa drugs were invented. Those could fight infections and certain illnesses. The Pap smear test was discovered to treat cervical cancer, which is something women can get. The kidney dialysis machine was invented where we were able to filter your blood. That's what the kidneys do. They filter your blood. And if someone had a problem with their kidneys up until this point, we didn't have a way to treat them. But with the kidney dialysis machine, we could pull your blood out, filter it, and put it back. Jonas Salk, and you're going to start to learn these with two names, Jonas Salk and Sabin. Salk and Sabin discovered the polio vaccine. Salk did it with a dead virus and Sabin did it with the live virus, but we credit both of those individuals for the polio vaccine. Crick and Watson, you're going to see those referred to together as well. Francis Crick and James Watson were the ones who actually described the structure of DNA. Up until that point, we didn't know that it was that double helix 3D model, and each place had different genetic material on it. So that was a wonderful discovery, and they won a Nobel Peace Prize for that. The heart-lung machine was invented and used for open heart surgery. It basically performed the job of the heart and the lungs while you were under surgery. And the first kidney transplant was performed. Here's that other name we were talking about. Albert Sabin invented the live polio vaccine. So we usually just credit them together, Salk and Sabin, although one did the live vaccine and one did the dead virus. Sigmund Freud is the gentleman that I mentioned earlier who studied psychology and began to explain those illnesses of the mind. He observed the conscious mind, or things that we're aware of that are happening, and of course the unconscious mind. So I like to describe this as sometimes you can be anxious about something or have some anxiety in regards to a situation, but you really don't know why. And that's your unconscious mind working through things that you're not even actively thinking about. So he helped us understand that. Christian Barnard performed the first successful heart transplant in 1968, okay? So prior to this, we had no way to transplant hearts. We had no way, if someone had a heart disease, illness, sickness, trauma, we had no way to save them because we couldn't do heart transplants. But as you can see, in 1968, he did the first successful one. Ben Carson is one of the people that you have to know as well. He was the first person to separate Siamese twins. So Siamese twins are what you see in this picture. They are conjoined twins, and he was the first one to successfully separate them and have them survive the surgery. Birth control was invented in the 20th century. Severed limbs were reattached in the 20th century. Medicare and Medicaid is the entrance of the federal government into health, into the medical world. So Medicaid and Medicare are federally funded, which means we pay federal taxes in your paycheck to fund Medicare and Medicaid for individuals who are under the age of 18 and not able to work for healthcare and health insurance. Those individuals who have disabilities or are of advanced age can qualify for help from the federal government through Medicaid and Medicare. HMOs were established as well. HMOs are health maintenance organizations. So we began to realize that if we focus on keeping someone healthy, they may not have as many long-term diseases and effects as others. And so it was really important to focus on maintaining your health, which is why that title makes sense, health maintenance organization. Let's maintain your healthy status and avoid the things that could cause you sickness and illness. Hospice was founded as well. Hospice is where people go who are transitioning from life to death. So generally, if someone has 6 months or less to live, they qualify for hospice. And hospice can help you as the patient, help the family members, all adjust to the impending death of the patient. It can help keep them comfortable while they're dying. It can help you set up plans for funeral care and costs. It can help take care of that patient if they were to need a lot of help during their final days with bathing, dressing, medications, anything like that. Okay, so it's a great support for people who are losing a loved one. Omnibus Budget Reconciliation Act is one of the big things we also talk about here. And basically what this says is that anyone who's working with the elderly should have proper training. Up until this point, everybody kind of did very unstandardized things. So it's like everybody taking a test and everybody taking a different test. There's no standard. We don't really know how everyone did in comparison to everybody else because you all did something different. So with OBRA, we standardized the care, which means we made expectations. So elderly should be treated this way. There's training that goes in place. And so what they called it was certified nursing assistants. That's how we started the whole CNA movement, and people who were trained in the CNA program on how to do those basic tasks like cleaning up patients, brushing their teeth, brushing their hair, assisting them with going to the bathroom and things like that. Moving forward, the first artificial heart was made. The CT scan was invented so we could see different aspects of the internal parts of your body. The AIDS virus was discovered in the 20th century. We also cloned sheep. Her name was Dolly. She was the first sheep cloned. If you're interested in learning more about cloning and interested in learning more about animals, then I would suggest you take biomedical technology. It's a wonderful class that comes after this one. Moving forward, gene therapy began, and we were also able to screen people in the womb. So we were able to do genetic screening, and that's either with the baby in the womb before birth, or even to people who would like to have a child but want to know if they run any risk of having genetic abnormalities, Down syndrome, different trisomy disorders, defects that are genetic, things like that. And that was wonderful because if someone knew that they carried the hemophilia gene, then they could test with another person to see what's the likelihood of their child having this disorder. The first test tube baby was created. This is considered the most recent medical discovery in the sense that we were able to fertilize an egg with a sperm and create an actual embryo outside of the womb of the mother. And this obviously is a step for those who were not able to conceive on their own. The average lifespan of the 20th century is 60 to 70 years, so we have made great leaps and bounds from 35 years in the 18th century. So if you guys have any questions, let me know. That was kind of a lengthy PowerPoint. It gives you a lot of information that you don't need, but a lot of information that helps you understand how healthcare truly has changed in the past 5 centuries. So this assignment that you completed, the historical person and the contribution to medicine, these are all the names of the people that you need. Okay, so as we go through this, Hippocrates is considered the founder of modern medicine. He was a Greek physician who led us to what we now know as medicine. Doctors also still take the Hippocratic Oath, which is basically to do no harm to their patients and to take care of them. Anton van Leeuwenhoek, you need to know. Edward Jenner, you need to know. Benjamin Franklin, Alexander Fleming, René Laennec, Elizabeth Blackwell, Florence Nightingale, Louis Pasteur, Joseph Lister, Clara Barton, Robert Koch, Wilhelm Roentgen, Sigmund Freud, Salk and Sabin, Crick and Watson, Christian Barnard, and Ben Carson. So if you've been following along, I gave you the name of all these people, and now you just need to make sure that you know what they did, which is in the PowerPoint from yesterday. And make sure you complete your assignment that is due today. It is Who Am I and What Did I Do quiz. If you have any questions, you guys know how to get in contact with me, and we will start some review before we take this test coming up later in the week. Thank you guys so much. Have a good day.